Good afternoon, everyone. Thank you for tuning into our third annual Climb Above Addiction event. This year, we're going to do our event online due to COVID-19, which lines up with what we're going to be talking about today. Let me introduce you to Kristen Williams. Hi.
Hi.
If you want to say a little bit about yourself and what you do.
Hi, my name is Kristen Williams. I've been a nurse for the past 22 years. I've worked in the operating room now for about 20 years of that time. I worked as a circulating nurse as well as a scrub nurse. At the moment, I am the clinical lead, also the charge nurse of the operating room over at Exeter Hospital in Exeter, New Hampshire.
Awesome. So today we're going to be discussing this current situation of COVID-19, but we'd also like to talk about addiction and see how that's affected you in your workplace. So our standout question today is, how has COVID-19 been affecting your workplace as a whole?
It has been affecting us, and we thank God that we live in New Hampshire due to the fact that other states in the area are having a much more difficult time in the hospitals. But it has affected us. It has affected our staffing. We have quite a few people that are not able to work due to comorbidities themselves, past medical histories such as diabetes, hypertension, and such. It also has affected the amount of PPE, which is personal protective equipment that we have in the operating room as well as the hospital. When it comes to masks, gowns, gloves, the amount that we have to protect ourselves has diminished quite a bit.
Awesome. So do you see an uptick with people coming to the hospital with symptoms? If so, do you have a test readily available, or do you see a shortage of that as well?
We do have testing. We actually have a ability to schedule testing for people that are coming in that have had symptoms. Instead of them going into the emergency room, they're able to call and make an appointment to be tested, in which they go through a line, and it takes about 10 minutes where they are swabbed and tested for COVID-19. We have seen an uptake in the amount of people that are coming through the hospital with symptoms. Not as much as they see in Boston and such, but New Hampshire is seeing an uptake, especially this week.
Okay. And you did mention before in the first question I asked with the PPE, so in your hospital you've seen a shortage with crucial medical supplies.
Yes,
has that been affecting you guys severely?
Yeah, it has. We are able to use, on a regular basis, we're able to use one mask per procedure. At this moment, we're doing one mask per week. So we're wearing one mask until it becomes grossly contaminated, and then we have to throw it away. But we do wear one mask per week, and we are given one N95 mask, which is the protective mask for COVID and other things such as tuberculosis. When it comes to gowns and gloves, we are sparing. We are not using as many as we usually do. We usually set up a field, we break, we throw away our gown, and then we're able to stay unsterile to help out the nurse in the room with the patient. Now we're actually putting a gown on and staying sterile throughout the whole time, waiting for the procedure to start. So we're saving on gloves, we're saving on gowns, and of course using the mask once a week. Yep.
Yeah. Okay. And also, do you see, like, you have any patients in your hospital right now who are on ventilators or
Yes.
in a critical condition?
We do. At the moment, we have 3 patients on ventilators in the ICU. We do have 19 people positive with COVID-19 in the hospital.
Yeah. So shifting gears, in your place of work, do you see people who have addiction challenges, and do you feel like they're at higher risk for contracting this virus?
Well, definitely people that are do have addiction issues do have a higher incidence of getting COVID. Any comorbidities, like I mentioned, hypertension, diabetes, anything that would alter a person's health would cause more of a ability to obtain COVID-19, such as addiction issues.
Okay, so with all your experience with what you see and continue to see on a daily basis, how do you think this segment of the population can arm themselves against COVID-19 and just take the precautions they need?
Yes, I think hand washing, number one, like we talk about over and over, and every news station you see, everyone's talking about hand washing. That is number one. staying the 6 feet like we should be right now during this interview, but 6 feet away, and just protecting one another. Watch out for one another.
Awesome. So thank you so much for coming with me today on this interview, and thank you so much for being with us today to talk about this coronavirus as a whole. I really appreciate you taking time out of your day to talk to us about this pandemic. It has been my pleasure to be here. This is truly a worthwhile cause, and although we cannot be together today, I hope we can continue to rely on your support through your contributions for a climb above addiction. Thank you.